my name is Mariam Bonde and I'll be explaining about Mycobacterium tuberculosis, the cause of tuberculosis disease. Classification and structure. Domain. This bacterium belongs to phylum Cyanobacteria and it belongs in family Mycobacterium cI and it's rod-shaped bacillus. Gram stain, weakly gram-positive, acid-fast due to mycolic acids. Oxygen requirements, obligate aerobes. This means this organism or this bacteria requires oxygen for its metabolism process. Virulence factors, mycolic acid cereal, which has a wax protection. Cod factor prevent phagosome lysosome fusion. Slow growth aids to persistence. Life cycle in the host. This organism is usually transferred through air. This means it enters the host through aerial pathways. So inhaled via droplets and it enters the lungs. Once it enters the lungs, it gets engulfed by macrophages but resists killing. Forms of granulomas to contain infection. Latent TB, infection possible for years. Reactivation, active disease when immune system weakens. Disease features. There are various features of this disease and they'll be explained as follows. Primal TB, often asymptomatic, and there is active TB. This is the one that is visible and there are various signs that they're externally observed or seen, and this includes chronic cough, sometimes with blood stains, fever, night sweat, weight loss, and there is disseminated TB. This can spread to kidney, bones, and brain. Incubation, it usually takes 2 to 12 weeks to positive tests. Symptoms may take months and years. Global burden. The statistics shows that there is about 10.6 million people developed TB in 2022 according to World Health Organization statistics, and about 1.6 million deaths among HIV negative and about more among HIV positive individuals. Highest incidences, this is highly statistically found in South Asia and Sub-Saharan Africa. Vulnerable groups, these are the groups that are at high risk to get affected with this disease. These include the HIV positive individuals, malnourished, clouded living conditions. Transmission. This disease is, as I explained earlier, it's transferred through air and it gets into the host through aerial pathways. This is airborne and it can be transferred through coughs, sneezing, speaking. Infectious dose very low. Prolonged close contacts increase risks. So like if somebody is infected and you have unprotected prolonged contact, you are at high risk to be infected with the disease as well. Prevention. Isolate infectious individual. Sometimes they could be quarantined or have specific ward and places and have specific measures of treatment, that is like downing your PPEs to prevent that spread of infection, like have your face shield, your mask, so that you can block direct contact of your aerial pathways, and mask and ventilation in healthcare settings. BCG vaccine in high burden countries. Latent TB screening and treatment. So you can prevent this by isolation, mask and ventilation in healthcare settings, like you're donning your PPEs, the personal protective equipment, the gown, the mask, the face shields. Diagnosis. There are several ways that this disease can be diagnosed, and this could be explained as follows. Tuberculin skin test, the TST, determines immune response. IGRI's blood test for TB specific immune reaction. Spectrum smear microscope, acid fast bacillus under microscope, culture, the gold standard, but it's slow, it takes couple weeks. Expert MTB rapid test determines rifampin resistance. Therapy. First line drugs, there are various drugs, and there, as explained in this slide, there is isoniazid, rifampin, diprisonamide, ethambutol. Treatment duration at least 6 months. Challenges: patient adherence, this is wrong regime. Drug resistance, sometimes some individuals, their body resists to treatment, and that has been challenged to among various TB affected individuals. New treatment, the bedaquiline, delamandine, improving MDR TB outcome. New data and future direction, shorter 4-month regimes now. World Health Organization recommend for some cases. M72 vaccine candidate, 50% protection in trials. Genomic epidemiology, whole genome sequence track resistance and outbreak. References: Centers for Disease Control and Prevention, the CDC, and the link is as displayed there. World Health Organization 2022 Global Tuberculosis Report, as explained in my former slides. Tuberculosis Program Report date, and final analysis of trial of M72 vaccine to prevent tuberculosis, New England Journal of Medicine, found in those articles. Thank you. That's all about my presentation.